Hello and welcome. Maria, can you hear me? Hmm. Hey Maria, it looks like so I'm looking at the interpretation icon and it doesn't show up that your email is connecting.
I'm sorry, this is Maria Luisa de Guzman.
Yeah, so
Oh,
I have you as our interpreter for this session, is that correct?
yes, that's correct.
Okay. It doesn't look like it auto connected you to the interpretation.
Okay, so
And I'm trying to add you by name and it is not locating you, which is interesting.
maybe my email, because I saw that it said interpreter and it was my email.
Yeah, and that it looks as though it's the same email that I added as the interpretation. Because it still says not joined on my interpretation screen.
So we can talk, but the people that I'm going to interpret are not connected. Is that what it is?
Correct. It's just you and I right now.
Well, that's nice. I don't know what to tell you.
Okay. I am working on trying to get you added as the interpreter. I don't know why. All right, I will Slack my group and see if they have any helpful tips to get you into the right place.
Okay.
I'll let you know.
Okay.
Thank you.
Thank you. I'm glad I signed in early.
Me too. Thank you for that. I really appreciate it.
I said, just in case something's not right. Ay, Dios.
Hmm. Maria, since we have a little bit of time, I might ask that you go out and come back in and see if that will
Okay,
I don't
I'll
know
try.
why I can't force you into the position and it didn't connect when you came in for some reason. The email looks the same as what I sent and you got the Zoom and that's what you clicked on the email, right?
Yes.
Well, I don't know that is exactly how it's supposed to work.
Okay, let me sign out and try again.
Okay, always the first IT tactic is turn it off and turn it back on and see if it works.
Okay, thank you.
Thank you. Appreciate it. So it's interesting. Now it looks like you're in here twice.
Twice, I was just going to say joining, and the microphone on the first part, on the first one is going up and down.
Yeah, you're okay. That is so
And,
interesting.
and the second one says joining, but that's all.
Yeah. It
I
looks
don't,
like your first one never closed all the way out.
oh, well, I closed everything out. So, okay, now there's only one.
Well, it's actually, yeah, wait. Okay, yep, you're right. Now there's only one. That was it.
But okay, do you see the microphone, like going up and down?
No,
Now it's you, and then
no,
it's now me.
that is interesting. No, I don't. I'm gonna start my video and just see if okay, that I do turn on, so that's fine. I guess you don't really necessarily need your video. What if I
Conf-
promote you to co-host? Let me see if that makes it so I can select you for the interpretation.
Let me see. Do you want to restart to install these updates now, or
Oh, you
I
have
don't,
updates?
I don't know whether I should press any buttons right now.
Um,
Should
how
I?
long does it estimate it'll take?
It, Let me see options. Restart, try in an hour, try tonight. Do you think it's something that has to
Could
do with this?
It could be.
Try tonight, remind me. Restart, I don't know if I should do that. You
Um,
tell
we have a little bit of time.
Okay, let me press.
I'm still trying to figure out, I cannot make you show up as interpreter. Uh-oh, you came in as Tim.
Oh, I did? Okay, let me just, oh gosh. Let me go back out and come back in.
Okay,
Thank you.
welcome. All right, there you are.
Yay, okay.
Very good. Oh,
Oh, you know what? Christina,
Yeah. Oh, I'm
I
Tim.
think you're coming in as Tim because he forwarded us the link, but see if you found something from Zoom webinar.
right,
Okay.
yeah. That'll give you your personalized link, so it should come in as you.
Email to your personal email.
Let me, yes, I know some, okay. I'll be back.
Okay.
Also, I just wanted to let you know, I accidentally went ahead and started the recording. I was working with
Oh, no.
Maria, our interpreter, and I hit start. I was like, "Well,
No problem. Should we pause it? Let me see. Is it
I can
recording?
pause the recording. The reason I haven't at this point is I didn't want to forget to turn it back on. I figured I would rather have troubleshooting recorded than miss the beginning because we forgot.
Oh, okay. Well, I think the presentation isn't until 18 more
2:50.
minutes.
Yeah,
Okay.
I've had it on since like 2.
Oh, okay. Perfect. Perfect. I do that too with my class. I'm like, and then you go tangent about something else and then you totally forgot.
Exactly. Well, and that's why I was like, I would rather have the video person editing this at the beginning, just cut it out than
That's true.
worry about missing it.
Yay.
Okay, there you are.
I'm going to text the group, particularly maybe to make sure that they get their own link.
Yes,
Yeah.
that would be fantastic. Thank you. And then Maria, our interpreter, was on. She was not showing up as allowable to set in the interpretation. So I had she had computer updates, so she is updating and is going to join us. And hopefully that all works out when she comes back on. Otherwise, I will have some troubleshooting to do with her when she comes back.
Cool. Thank you.
There's Tim.
Hi, Tim.
Good morning, team. I'm strangely nervous, but also so excited.
I'm talking to myself right now. Yeah.
Can we pause? Is it possible to pause the recording while or do we not have control of that?
We do. I was telling Daria, I have it recording. I just I accidentally started the session and I apologize. I was more afraid to forget to turn it back on.
Yes,
So
I do that
that's
all
why
the time.
So I can.
Does that look okay? Let's see. I'm gonna put put people on the, and then want to do present full screen. Oh, full screen. Okay. Okay. Right. So I don't see the pages on the bottom, but I do see. Okay. Interesting. Perfect. Okay. I'm gonna stop share for now. Oh.
Yeah, that looked perfect.
Welcome, Beth. Welcome, Francine. And Jennifer. Sonia. Marama. Okay.
Got folks from Alabama, Nebraska, Missouri,
Mm-hmm.
Nevada, Texas. Wonderful.
Wow. I honestly cannot wait for next year when we're in person. So much fun. Hi, Madeline. Now I recognize your name. Hair Sweet. That's what the Karen California training. Yes. Welcome. Okay.
So we're gonna start in 3 minutes, Darouny, is that, okay, all right, so we're gonna start right at, I'm in California, so it's 11:50 here, about to be 11:50 here, so just so everybody knows, we're gonna start right at the, I guess the 50th minute.
Interpreter, I put you on as English, so I don't hear you in English. Yes, I hear you. Yes. Mhm. Mhm.
All good?
Yes, because I think you probably are in the Spanish channel earlier, because I'm in the English channel. Mhm.
Okay.
Okay. Would you be interpreting in Spanish? So I wonder if you need to be in the Spanish channel? No, because I'm choosing the English channel because I'm on the English side. Oh, okay. Yeah, I think it's the globe button, and then you know how you click on it and it says English or Spanish, and I think you have to put Spanish. I'm assuming. Yeah, like on after in my on my view, next to reaction, there's a globe, and then you click on that, and that's the interpretation thing. And then so when you click on that, there should be a drop down menu, and you choose the language you want to hear. That's my end as the yeah, you should see it. You see at the bottom, in the for me, right next to reactions, there is another tab, and let's see, and it says interpretation. Do you see that? It looks like a globe, a small little thing, or circle with some hashtags down. And it says interpretation. Welcome, everyone. We're troubleshooting some interpreting issues before we get started. Just if you haven't done so, feel free to put your name and organization or state in the chat so we know who's in the room with us. All right. Are we good to go, interpreter? Oh, okay. Oh, okay. It could be because the way you're organized is different. The way your tabs are organized is different. Yeah. Yeah. Yes. So if you speak it, then they're probably going to hear you there. I'm assuming. No, right. We won't hear you. Yeah, put it in Spanish. I think so. I think you need to, Liz, are you there? I think, because I'm going to be I'll be sharing screen, so I won't see the chat.
Yep, I can handle the chat.
Liz, perhaps maybe she can connect with you. I don't know. Is there a way?
Are we still
through
having
the chat?
language translation issues?
Okay. All right. So thank you. Okay. Thank you. Thank you, interpreter. All right, let's get started. It's good to be in company with everyone, even though we can't see your faces. We see your chat, and we appreciate you being here with us today. Our session is called Foundations for Community Health Worker, Equity-Based Resources. And so I'm here, and so before we get to introducing ourselves, so let's get to today's agenda. We only have about an hour and 10 minutes with us. And so we want to really be able to share and allow for questions and answers and discussion as well. So on our agenda, we have 4 things. The first one is just sharing the resources, the training resources for the foundation textbook, and some of you might already know of them. The other one is also telling our story about how we really try to focus on building CHW leadership in the creation of this 3rd edition. And then we want to spend some time on doing some sample training activity around a role play. And we hope that at that moment you will join us in doing that role play. And finally, we'll end our time together with some questions and answer. So those are the 4 things we have on our agenda today. But before we get started, I want to introduce myself and our colleague and my colleague. First, my name is Darouny Somsanith. I am the current program coordinator for the Community Health Worker program at City College of San Francisco. I've been a community health worker for over 20 years. I love this work, and I feel so privileged to be in the position and in the company that I'm with. I am also the board secretary for the California Association of Community Health Workers. And so now I'm going to throw it over to my colleague, Cristina.
Hi, good afternoon, everybody. My name is Cristina Arellano. My pronouns are she and her. And I currently work with the Alameda County Department of Public Health here in the Bay Area, in Oakland, California specifically. And I co-authored the case management chapter in this upcoming 3rd edition. And I also use the book. I've been using the book for the last year or so to be a mentor and also a trainer with some county work, with some surrounding counties around us, specifically Monterey County, when training CHWs. So thank you for being here, and I'm going to pass it on to Mattie Clark.
Hi, everyone. I am Mattie Clark, community health worker. I've had the privilege of working with G.A. Carmichael Family Health Center as a clinical community health worker during the past 10 years through a grant partnership with the State Department of Health under the umbrella of the Delta Health Collaborative. I'm currently a community health worker with the State Department of Health and Office of Preventive Health. District 3, I service 9 counties. And I'm also a trainer for Monterey County. This is going to be the 21 weeks of community health workers training we will be doing. Also, I think this is going to be like our 4th cohort of community health workers training, which I kind of like do it via Zoom. I was blessed to be a co-author of this book My focus is on chronic health conditions like hypertension. My focus point is my chapter is located, my part is located in chapter 16 of the Foundation for Community Health Workers. I will pass it on to Tim.
Good afternoon, everybody. My name is Tim Berthold. I'm also a contributing author to the Foundations for Community Health Workers book and part of the Foundation's consulting group, a team that's doing trainings around California primarily, including in Monterey County. And I am incredibly fortunate to have worked side by side with community health workers throughout my entire career in public health. So I think we can go to the next slide. So today we're talking to you about 3 different foundations resources that we use for training community health workers. The Foundations for Community Health Workers book, the training guide, and our YouTube channel, which has short educational videos. Can go to the next slide, Darouny. So the 3rd edition of the Foundation's book was just published in June by Wiley. It was a labor of love with over 60 contributors, the majority of whom are community health workers. The book is designed to highlight CHW knowledge, skills, research, and best practice models. And it incorporates guidelines developed by the CHW Core Consensus Project, or C3 project. So now next slide, the back one slide to the training guide. We also have, yeah, there we go, yeah. We also have developed a training guide. It's a free ebook. It's available on the Wiley site. It includes hundreds of training activities and assessment resources that highlight CHW skills and competencies like cultural humility, ethics, case management, home visiting, and group facilitation. Each activity includes the learning outcomes that we're shooting for as trainers. It includes all of the materials that you need to facilitate the training activity. And as teachers and trainers, you're absolutely encouraged to revise and adapt any of these training activities as you need to better meet the needs of your local communities. And then finally, there's also a free YouTube channel called Foundations for CHWs, where you can find hundreds of short educational videos that we developed in partnership with CHWs that are designed to highlight core competencies and person-centered practice skills. They include short interviews and counter and demonstration role plays. The thumbnail that you see on the screen is a short 3-minute video that depicts a conflict between 2 community health workers that was created by Juanita Alvarado and Jamila McCoy based on their own experiences with workplace conflicts. And I think kick it back to you, Darouny.
Right. As Tim mentioned, so the 3 things that while we were thinking about developing the 3rd edition was really about giving, highlighting the leadership of CHW, their experiences, their voices, and of course, the diversity of this work throughout the United States. Woven throughout every chapter is our core values, which is emphasizing health equity and social justice for our community and the work, in addition to really focusing more on the person-centered practice, as well as trauma-informed care, and of course, cultural humility. What's new about the 3rd edition also is our stronger connection with the CHW Core Consensus Project, or C3. And so every chapter starts with a graphic around the relation of that chapter to the C3 core skills, as well as at the end of the textbook, there is an assessment checklist. As Tim mentioned, there are over, and when we highlight the leadership and voices of CHW, there were over 60 contributors to the book. Many are community health worker. So, yesterday during the opening remarks, when we heard from the CHW leadership and also some of the board members, and by the way, the board members for NATRA, many of them were highlighted in the textbook, including Denise Octavia Smith, and of course, the founding board members as well. So many community health workers also co-authored the chapters as well. And every chapter was always CHW centered, in a sense that we always thought about how is it relevant to the work, and also how is it geared towards the CHW themselves. And again, the diversity of the voices and the stories of CHW. We know that there's many community health workers doing this work throughout the nation. And so every chapter features a profile of a community health worker. And in the book itself, there are over 100 quotes. In each of the chapters, there's also now new case studies developed by the community health workers featured in that chapter. And finally, in addition to the written text, we also wanted to draw on the knowledge and the skills of the community health workers themselves. So our photographers, as well as our graphic artists, are community health workers as well. So one I want to highlight, because I worked with her very closely, is our graphic designer, and her name is Blanca Goodman, and she's a community health worker now in San Mateo County. And she really did all of our QR codes, thought about really creatively how we want to make do the spreads in every chapter. So she did the big ears, big eyes, small mouth, and again, the C3 connection, as well as other graphics throughout the book. So now I'm going to send it over to Cristina.
Hi, thank you, Darouny. Yes, so I just want to, highlight the photographers. As Darouny mentioned, the photographers are people that we know, that we've worked with. The first being Julian Francis Montgomery, who is at the top, my left corner here. That's Francis. They are an active CHW working in San Francisco and a contributor to this book, not just his photography skills, but his knowledge and experience. And then there was also the very lovely, the very warm Amy Sullivan, who I think was behind the camera here on this picture. But they both worked together in taking a lot of our headshots and a lot of the group photos that you will see throughout this book. Which is great. One of the other things that has changed with this third edition are the quotes. Some of them have remained the same just because they're just that powerful. And I just want to read a quote I'm going to read the top left one here, TG. They say, "I was on the bus going home and this guy kept calling my name. At first I couldn't tell who it was. It was a client from way back. Someone I never thought would make it because he was caught up using and really sick with AIDS. He looked so good. When he was getting off the bus, he grabbed my shoulder and he said, 'You never gave up on me.' And that helped me not give up on myself." I just sat there and cried. I'm not someone who really cries and I just sat there and cried because nothing will ever feel as good as that moment. That's when I know that what I do is worth it, right? Isn't that a beautiful quote?
Mm-hmm.
There are days in which, CHWs do this work and we question whether our work is having an impact. And I really feel that TG's quote here reinforces that, yes, we are making an impact, one person at a time. And so there are similar quotes about not just the impact, but the things that we see throughout the book. There are over 100 quotes in the book. And now, this is the interactive part. I'm hoping that I can get 2 people from our audience here to read one of the quotes. If somebody can read the Paul Mendes quote out loud, and if somebody else can raise their hand to read Avery Newen's quote, I would greatly appreciate it.
And Liz, is it possible to unmute a couple of the participants so they can read out loud, or should we do this?
I absolutely can. I don't have any hands up at the moment. So if anyone would like to volunteer, please use your raise your hand feature. Oh, I found Jennifer and then Sarita. So I will unmute Jennifer Hines first.
Hi, everybody. Can you hear me?
Yes.
Yes.
Okay, perfect. So I'm going to read Paul Mendez's quote. He's a CHW. He said, I may not have a fancy college degree and a bunch of letters behind my name, but I have a PhD when it comes to understanding life on the streets and addiction.
Yeah. Thank you, Jennifer.
Beautiful. Sarita, do you have interest in reading the second one? You raise your hand again. Oh, wait, you just took it down. Where did you go in my list? Sorry, you took your hand down.
I don't know if you can still hear me, but I can read the next one if you would like as well.
I actually just unmuted Sarita.
Okay.
You should be good. Thank you very much.
Thank you. Hello. This quote is from Avery Gwynn. When I signed up for the CHW training program, I thought I'll do the training and I'm gonna be able to help my clients check off more things on their list and therefore be a more effective case manager. But I learned that people are not checklists. It's about using motivational interviewing, coming up with ways to be creative and meet them where they're at, respecting their personhood and their own agency and the choices that they make.
Yeah. Thank you. Thank you so much for reading that, Sarita and Jennifer. Yeah.
Thank
So
you.
next I am gonna pass it on to Mattie. Mattie Clark.
Okay, thank you again. We are interviewed to develop 23 pages in the foundation book. Nevertheless, I didn't interview alone. At this time, I want to take a moment to pause for silence to remember my colleague and co-author of Chapter 16, Miss Lorena Kimona. Can we please pause for a moment of silence? Lorena Kimona was my co-author for the Chronic Condition Management Chapter 16 of the Foundation for Community Health Workers book. She was a community health worker, a program manager with Roots Community Health Center located in Oakland, California. There were 23 community health workers who contributed community health workers profile work across the United States. We could say just worldwide pretty much, with a variety of health topics like chronic condition management, COVID-19, violence prevention, providing services to people who are unhoused, reentry services, medication assisted treatment, or sometimes called MET, hospice support for ones that's, transitioning, transgender health and equity, survivors of trauma, community organizing and advocacy, refugee help, school-based health services for families. And I'm going to turn it back over to Tim. Or Cristina. Cristina.
Yeah, I think that might be me. Thank you. Thank you, Mattie. So yeah, so as I mentioned in the introduction, I helped I with the support of Tim co-authored the case management chapter. This chapter has a lot of technical aspects of the role. All of them from a trauma-informed lens, all of them very client-centered or person-centered. It shows us how to create a SMART goals, action plans. It allows us to perform person-centered health assessments. It also helps with, telling the CHWs, teaching the CHWs on how to work with a team, interdisciplinary team, and also how to take notes and when to terminate services. So during my time writing this, I was a housing case manager with lifelong medical care. Lifelong medical care is a federally funded community health center here in Oakland, California, and there's a lot of other little clinics throughout the Bay Area. So as a community health center, I was able to provide wraparound services for our clients. The population that I served were people that were unhoused, or the homeless population, or that had just been housed. And the clients that were referred to our program are clients from the county. These were clients that had, I guess, unfortunately met the criteria for a number of years, that they'd been unhoused, had chronic conditions, chronic health conditions, mental health, substance use. They were just really seen as the most vulnerable population. So they were assigned a case manager, and I happened to be one of them. So in writing this book, this chapter, that was my lens. That was my experience that I was sharing, those wraparound services, right? Providing support with medical, getting reconnected with primary care physicians, as well as maybe providing harm reduction approach if that's what the client wanted, or connecting them with social services. So the case study here that you see on the screen is a combination of 2 to 3 clients that I served. The name is Marcos Bernales. And so I just really wanted to show the CHWs what supporting somebody that has been unhoused looks like. This person, what somebody that has suffered a medical emergency while being unhoused looks like, and trying to recover while still being unhoused, and how this added to their debilitating anxiety, right? And so I just really wanted to show that in the conversations, in the dialogue, in the little paragraphs that explain where we were in the case study. I wanted to show what self-doubt looks like in a client. I wanted to show what exploring ambivalence with a client looks like. I wanted to show what giving somebody agency that hasn't felt that hasn't been given that in many years or ever in their life can look like. I wanted to show what truly listening to somebody can reveal about them, and when they're ready to reveal that. So, that is the case management chapter, a lot of technical things, all through trauma-informed lens, as well as just client-centered, and my experience, which, is just my experience, but I really wanted to provide that, how I was able to support these clients using all of the CHW tools that are drawn in this book. Yeah, thank you, Jada. I see that. So, lastly, I do want to say that contributing to this book was a really big deal for me. It was a full circle moment that I didn't expect, because years ago, I had the great fortune in meeting Tim at the City College of San Francisco. And he was an instructor for a few of my classes. And so he taught from an earlier version of this book. So years later, to be asked to contribute my experience to this book is really, beyond my wildest moments experience for me. So I am really grateful. And I just, as all CHWs want to do, we just want to pass it on, right? Pass on what we've learned and share that experience and knowledge so that the work continues. So thank you. And I believe we are passing it on now to Mattie.
Okay, great. To be effective in my community as a community health worker.
I think, whoops, sorry. I think we're a little out of order. I think I go next, and then I introduce you, Mattie.
Okay. Apologies.
Sorry for the interruption. All four of us, Darouny, Mattie, Cristina, and myself, we're part of the foundation's consulting group, and we use the foundation's resources to train and certify CHWs in California, both online and through hybrid trainings. What you're looking at is a picture of a group of CHWs that we recently trained in Monterey County, California. They graduated in May of 2024 of this year. Our consulting team is made up of 17 of us. The majority, 65%, are CHWs. We've been doing, we're about to start our fourth cohort of CHWs in Monterey, and we do that through a 5-month certification program. And we co-facilitate training modules that cover essential CHW competencies based on the Foundation's book and on the C3 project standards. So things again like case management and chronic conditions management, trauma-informed care, home visiting, group facilitation. And we also address professional skills such as managing scope of practice, ethics, managing professional boundaries, working as part of an interdisciplinary team, documenting your work, preserving confidentiality, all of the skills that CHWs need in order to provide quality and culturally sensitive services to the clients and communities that they work with. As trainers, CHWs are able to highlight their experience, their knowledge and skills, and how they work to promote health equity. And of course, they also serve as role models for the next generation of CHWs in training. And I'm going to kick it back to Darouny.
Thank you, Tim. And I'm so honored to be part of this project. And what really appealed to me was the idea of, that theme, growing CHW leadership and really allowing, as a team, to develop facilitation skills, but also other skills needed to be effective teachers of other CHWs. And so we work tirelessly as a team to really help new CHW to gain those skills and that knowledge to be trainers, because that's what we want is the next level in terms of like CHWs training other CHWs. And so in terms of the project itself, the training, it's done in a hybrid model. So there are Zoom sessions, there are Canvas readings, as well as discussion forums, a little bit of quizzes. There's also in-person meeting. So students get a chance to practice the skills in person while making it more accessible where they can learn online via Zoom and also Canvas. We also work a lot with local employers to allow the students to get firsthand field experience to really see how the concepts they learn while in the class, how it looks like in the real world. And we also, for our students, we do a lot of like role plays, which we'll hear about later, but also projects and presentations, and really allowing it to be a very participatory type of learning experience and seeing the group work together as almost like a learning laboratory, on an ongoing basis. And finally, the students end with what we called an oral verbal performance-based exam. So they have to do a 15-minute role play demonstrating how they would interact with a client for the first time in a, person-centered, trauma-informed way. And so they have to finish that and successfully complete that in order for them to pass the program. And so I'm going to ask a little bit. So since Mattie and Cristina are both trainers, Cristina, what has been your experience around being a part of the Monterey training?
Yeah, just, talking about the role playing, right? I think that's really what people are really drawn to. What they love it. It's as nerve-wracking as it can be to the role play and practice. They really appreciate that. One of the asks has been for the trainers to role play, so be in, over Zoom, we're doing a role play, or in person when we do those in-person trainings, they want to see us work for 10, 15 minutes, right? And then they get to provide feedback to us or ask us questions. One of the other things that I've noticed too is when we do the round robin, it allows them to learn from each other, right? Like, oh, okay, like I didn't think of asking, I wouldn't have gone there, but they went there with that question, or that's an interesting way, a way that I'd never thought about asking that question, or that was a great affirmation. I don't throw enough affirmations out there, right? So it gives a moment to self-reflect and to learn from each other in those round robin or those round robin or those smaller groups when we're doing the role play.
Thank you, Cristina. How about you, Mattie? Oh, I think you're muted.
My phone. Okay, I'm sorry. Hey, so for me to be effective in my community as a community health worker, I had to meet the core competency skills. I had to be able to meet them in order to be a frontline worker. Being a part of the community I serve, I recognize social determinants of health. I know the resources in my community, what my community lacks. Like we don't even have a hospital, affordable housing, transportation, adequate health care, no jobs, no growth and development. We're living in a food desert. And if you had healthy food and you got it, it was so expensive that it couldn't be afforded. So not only am I a community health worker, but I am a product of my community. I was a mother for children living on a fixed income. Sometimes I went without water. Sometimes I went without lights. Sometimes I went without gas. And most of it all because I wanted to make sure my children ate and make sure they had a place to lay their heads. So a lot of times, being a product of your community, and as a parent, you really want to make sure that all of these necessities is provided for your children. They're young, they don't understand, what you're going through. And, I had to do some revamping. So this prompted me to get up and advocate for my community. I was able to provide health education, case management, home visits, referrals, medication adherence, DS&MP training, CDS&MP training, blood pressure monitoring, along with a blood pressure monitor if it was needed, glucose training, along with glucose meter if it was needed. And this was through a partnership with the Mississippi Shine Project. I provided DPP training along with success stories and resources, food and nutritional training in order for them to monitor their sodium, their carbohydrates, their sugar intakes. And I met the participants where they are, whether they was at the club, at that Double Quick where they sell that fried chicken at, I was right there making sure that they understood that this was, not healthy, that if they was going to get the food, at least pull the skin away or try to, go to the bake, boil, and broil method. I worked with a diverse group of people. This is where I had to use my culture humility training. This taught me the value of respect for culture differences. I had clients that didn't believe in medication, because of their culture belief. They would use all natural remedies, herbs from the earth. I had worked with participants using telehealth. Also done a research study on African Americans that was at risk for cardiovascular disease. I had to shift gears because COVID-19 set in. And when COVID-19 set in, that means that I had to get up and not leave the patient because, they was fear set in. They didn't know what they was gonna do. They was afraid to leave home. So that means putting on PPE, all the way geared up. If I needed to go to that grocery store, if I needed to pick up medication, take it to that participant home and drop it off. If I needed to do telehealth, I provided them with a cell phone or a tablet to make sure that they had an opportunity to respond back to me. This taught me a valuable lesson, how to reach people even in crisis through outreach advocacy, like health events. All of this work training I had, it took me to this place where I am now. I utilize every bit of training to go into with utilizing the Foundation for Community Health Workers, 3rd edition chapter of chronic health condition, training modules, learning objectives, foundation resource training methods like presentations, small and large group discussions, case studies, role playing practice, assessments, discussion, and quizzes. As a trainer, my joy comes when I'm encouraging community health workers. I am always positive and always give positive feedback, especially when we role play using scenarios from the Community Health Workers 3rd edition book, chapter 16. I look for the participants to provide me the ORs, which is open-ended questions, affirmation, reflective listening, and summarization. Lastly, I love the big eyes, the big ears, and the small mouth, because I'm one of those people, when I get to talking, I don't know how to shut up. So I give them the opportunity to speak while I sit back and do active listening skills. I try to keep my mouth shut and learn from them. I can tell that they are grasping the concept of the ORs because I observe them when they are role playing and doing their teach back to me. Thank you. Now back to.
Thank you, Mattie.
You're welcome.
As you can see, through our community health work contributors, we have a wealth of knowledge, and allowing them to be a part of the training team in such a meaningful way in terms of a core partner in training other new CHWs is just, it helps the new CHWs, in addition to it helps develop the skills within the seasoned CHWs to be trainers and also maybe advocates for workforce development for other CHWs as well. So next we have, so we mentioned before that we use a lot of role plays, right? And it's one of the core, like almost every session, whether it's at the college or through the Monterey training or other trainings that we do, there is always a role play, always. Whether it's 5 minutes, 15 minutes, or 30 minutes, because role plays is one of those things where, when you learn about the concepts or teach the concept or share the concepts of cultural humility or trauma-informed care or like person-centered practice, how that shows up is by how people communicate that to another person, like their client or their patient. And that doesn't really, and that to be able to have the words and then the kind of also nonverbal communication that comes with building that rapport, the more you practice it, the more it becomes second nature. And so role plays are so important because of that, because you're able to teach these kind of concepts and really allow people to refine and really then also see the context of what they say and how they act within building that relationship. And that is just, it's valuable because it's very unique to every single person. And it also, again, it's a muscle that you got to practice, right? It doesn't come naturally. And so, so today we want to do a small group role play with that. And so I want a little bit, so before we get into the role play, I also want to share, allow Mattie to kind of set up as well as the next activity, which is a round robin role play. And again, we invite you to now be a part of it once we start the process, and ask Liz to allow people to kind of come off mute as well.
And I think I'm going to do the setup for this one.
Oh.
And Mattie and I are going to do it together, but this is the first time that I've ever facilitated a role play with people who I can't see, right? Usually we do it on Zoom, but you can see the faces and hear the voices of the participants, or we're doing it in person. So this will be a little bit of an experiment for us. So hang in, please, and we're going to count on you to participate. What we're going to do is a training activity that we use a lot in our trainings, which we call a large group round robin role play. So when we start the role play, Mattie is going to play your client, Rosina Walker. based on the client scenario that she developed for her chapter on chronic conditions management. So your client, Rosina Walker, has hypertension and is struggling to manage it. And this is not her first visit. So let's imagine for this, for the purposes of this role play, that you're meeting with Rosina Walker in the health center. You've met with her before. You've already introduced yourself. You've reviewed confidentiality policies or HIPAA policies. She's familiar with the services that you provide in the clinic. So your goal today is really going to be to try to apply your person-centered skills, perhaps some motivational interviewing, to help Rosina Walker talk about what she's going through, what her concerns are, what her priorities are, what steps she thinks that she can take in order to try to enhance or improve the quality of her health and her well-being. As we start the role play, I'm going to be facilitating, and I'll ask for a volunteer to start off. You all collectively are going to play Rosina Walker's CHW, and you'll take turns asking Rosina one question or making one statement. Then Mattie, in the role of Rosina, will respond. We'll call on somebody new to continue the role play, again, by asking one question or making one statement. So make sure that as we do the role play that you're listening really carefully to your colleagues, both to what the CHW is saying, and of course, most importantly, to what your client, Rosina Walker, is saying. And we want to remind you that as we're practicing a person-centered approach, that this is not the time to jump in with advice or suggestions or immediate referrals. We want you to take a more quiet approach to using those oars that Mattie talked about earlier: open-ended questions, affirmations, reflective statements that are designed to help your client, Rosina, reflect, think, feel, and talk with you about what's going on in her life. Before we begin, is everybody clear about sort of what we're gonna experiment with here? We're gonna try doing this role play.
And I believe we would like you to have your hand up, and then we'll call on you because and then Liz will know who to unmute.
Yeah, like Liz did with Jennifer and Sarita, if you raise your hand to say that you're willing to volunteer to play the role of the CHW, then Liz will be able to unmute you so that you can participate. And the first person that volunteers and goes first, you have it pretty easy because you can just start the role play with your version of, "It's really great to see you this afternoon, Rosina or Ms. Walker. How can I help you today?" And then Mattie will go ahead and respond. So
And we
I
have
see
our
that
first volunteer.
Rose, you're volunteering to kick us off. Thank you so much for volunteering.
Rose.
Please go ahead and start this role play.
So good morning, Rosina. How are you doing? Are you taking your medication daily?
Good morning. I am, but not at the same time every day.
Okay. Is there some type of medication reminders that we can maybe put on your phone? Or are you using a medication, what do you call those? The little things where you set your medication daily, or what is the reason why you're not taking it daily? What can I help you with to help you set a reminder for that medication?
Well, I think maybe you can show me how to set a timer on my phone. That would help.
And then I just want to remind you, thank you, Rose. Now we're going to turn it over to the next volunteer who will step in, play the CHW, and continue the conversation. Thank you, Rose, for getting us started. Who's willing to continue the role play? Great. Joanna.
Hi, Rosina. So let me ask you, besides the fact that you're not taking your medication on time, what else is going on? How is your medication going? Is it working for you? Is there any specific reason you're not taking it on time? Talk to me.
Um, I think I'd be so busy and I have some to worry with these children so much that I sometimes forget.
Okay,
So,
but I understand that. Of course, we all have kids and we all go through that. But just remember, you know how they say in the plane, you have to be okay before you can help the kids. So you have to take your medication in order to provide for them, right?
yes, I understand that.
And
And
today,
thank you, Joanna. We're going to go on to the next volunteer and keep building this conversation. Those were, I want to say, those were wonderful questions and statements, but also the way that you phrased them. And even though we can't see you, we could hear the quality of your warmth and respect in your voice.
Absolutely.
So thank you. And Amber.
So I hear that you're busy. Life can definitely get away from us some days. We all have a lot going on. When you think about kind of your ideal schedule, where does medication fit into your day? Dropping kids off, whatever it is you have going on. What does the ideal situation look like for you?
I think when I get ready to get the kids to the car, I kind of grab my medication, to take it. And sometimes I be in such a hurry, I just forget. So I gotta see, is there any other way that, or maybe another time, probably, you think, that I can take my medication?
Sure. Have you considered talking to your provider about, are there other options for medications that maybe have a different routine than what you're currently doing or anything like that?
No, I hadn't thought of that, but that's a great suggestion. You know what, Amber? I'm gonna try that.
And
Great.
let's get another volunteer in to continue the role play. We're building, you're learning a lot about Rosina's life, right? What's one of her challenges? Oh, sorry, we can't hear you. I keep forgetting about that. So one of her challenges is time. One of her challenges is being a single parent. We still don't know how many children she has, but she's raising those kids on her own. And that comes first in her life, like it does for a lot of parents. And self-care is sort of a secondary thought. So that's part of what we're learning. Who wants to continue the role play? Sandra, go ahead.
Hi, Rosina, have you thought about a pill box that you may be able to place in your purse so that when you've left home and you've forgotten to take that medication, you'll have it available to you? Had you thought about that?
Sandra, I have a Planner already. I put that medication in that Planner and I drop it in my purse, and sometimes I leave my purse. I'm in just that big of a hurry.
Well, one thing we must remember that self-care is the most important. And I think you did mention we don't know how many children, but keep in mind those children need you. So if there's a note in the purse, a note in the car, a note somewhere that you have a reminder, that may be beneficial to you.
Sandra, that's a great idea. I was thinking about that at one point, but I didn't, go through with it. I would probably use sticky notes and put them on the refrigerator, put one on the door before I go out to remind me, hey, make sure you grab your meds if you haven't, or take your medicine. Thank you so much, Sandra, for that great idea.
Let's try that and I'll talk to you another time, okay?
Okay.
And let's get another volunteer and let's continue this conversation. Maybe let's talk with Rosina about a topic other than the medications management. What else might you want to ask her? What else might you want to know about Rosina's life or her challenges? And we've got Mattie or Madeline.
Hi, Rosina. How are you doing today? I wanted to ask you, how is your stress levels with being a single mom and having multiple children? How are you finding time to manage that for yourself?
Madeline, that is an absolute beautiful question. Sometimes I wonder myself. I got 3 children and they are stair steppers. And what I mean about that, I have a 1-year-old, I have a 3-year-old, and I have a 5-year-old. And trying to get them to the daycare, trying to take care of them at home. I'm having money issues because I'm a single parent and being able to provide for my children because of all of the things that's going on, and everything is so high where I live. I mean, it's like I can't afford anything. Do you have anything that you could suggest that would help me?
Madeline, you want to do one more go at it?
Yes, can I? Yes, Rosina, I think you have so much on your plate and you are so strong and your children are so, oh my gosh, I'm blanking. Your children are so lucky to have you as a single mom, and I appreciate everything you do for them, and I find that it would be hard to find time for yourself, especially with trying to make money and working. Do you have any hobbies that you like to do that maybe we can make that into like some income?
Yeah, I love baking, but
Oh,
food is
that's
so
wonderful.
high. But food is so high, I can't afford it. And I find it, I just can't because, I have to feed my children first.
Of course. Are you on
Let's
any
and let's
government?
stop for a second and
Sorry.
just talk about this, and then we'll ask for a new volunteer. Madeline, I think it's really important that you're asking about levels of stress, and if folks you can comment on what's happening in the role play in the chat, since we can't always hear your voices. How would you be rating Rosina Walker's stress level if you all were the CHWs? What are you grasping so far from this just 5 minutes of conversation about her stress level? High, Madeline says, yeah. And why is that so important? Because there is an incredibly strong association or link between stress and chronic condition, stress and hypertension. So that's a really wonderful question to be asking about. Let's just talk a little bit in the chat. We're gonna end this role play in a minute, but where
Tim,
else? Yeah, go
I
ahead,
just wanted
Maddie.
to say one thing as well. I also like the fact that Madeline kind of like, even though I was being rolling with resistance and there and being a little on that side, she gave me some positive feedback and kept encouraging, and was pushing me, to do the right thing. So I just noted that was just one of those things that I love about CHWs. When they're learning, they give you that positive feedback. That means that they're really paying attention to what you're saying and what's going on with your health. Those are some of the things that we have to do as CHW. So I appreciate it. Thank you, Madam.
That's the A in ORS, the affirmation, which sounded like it was important for Rosina to hear. And I think in general, it's important for all of us to hear that somebody sees and hears the gifts that we have, the resources that we have, what's wonderful or beautiful about us, especially in the moments when we maybe don't see that about ourselves. So this was just a taste of the round robin role plays that we do in class. We can talk about it in a moment, but I'm going to kick it over to Cristina to just do a little bit of a debrief like we would do in a training.
Yeah, before I get to the debrief, I just want to give Georgina an opportunity to say she's had her hand up, and if she had something that wanted to contribute, and then we can move on to the debrief. Georgina?
No, I just wanted to participate in the role play and just also asking I'm sorry, I forget the patient's name. Are we
Rosina Walker? Go ahead and ask. What would you say if you could?
So Rosina, I hear you, you have a lot on your plate. You have your children, your medications, and understandably, it can go off the radar. So other than your medications and the stress level, like what is it that I could help contribute to what you're doing to help alleviate some of that or even give you some resources? Because we want to get the medication out of the way, the kids out of the way, like what can I help you with to help you on the path to better caring for yourself?
Yeah, that's wonderful. Thank you, Georgina. I actually think that was a great way to end that that round robin, because it is true. I think a lot of the times our clients want something tangible. Give me something that is going to help me today. Something I can hold, something I can feel. You know what I mean? Like, we could action plan till the cows come home. We could action plan till the next big blue moon, right? But like, what can you do for me today? What is feeding me today? What is helping me today? So I definitely appreciate that. And I also feel like it's a great way to get that client's rapport, right? Build that rapport and get that like, oh, I can depend on this person. This person is somebody that can support me. So after every, activity, we have a debrief. And the debrief, we go over a plus and delta. With the plus, we go over the plus just means like positive things that we heard that were done really well. As Tim mentioned and Darouny mentioned, sometimes it's just your tone, that warmth, were you welcoming? And sometimes it's just a really great positive affirmation, which we did hear a few right now. So we want to do that, right? We all want positive affirmation. What am I doing well? Tell me. That's the same thing our CHWs want to know. What am I doing well? Let's give that to them. And then the delta we were also going to talk about those missed opportunities. We're going to talk about those teachable moments. We're going to do it in this way that isn't wagging our finger at them. One of the things that I like to do is just like, if somebody asked something that I'm just like, oh, geez, like, or was just really jumping into giving advice. And I would say, hey, what were you trying to do there? Like, what were you like, what was your intent? Right? Because sometimes as CHWs, our impact doesn't match our intent, right? Our intent could be to help this person out, but our impact by telling them what to do and not listening to them really cuts off their agency, right? It doesn't give them a right to self-determine, right? So we have to be aware of that, right? And so that's, those teachable moments, right? With the delta. So we're going to do that right now. First, I want to ask Mattie how that was. How was that for you, Mattie? Did you feel heard? Was there something that somebody said that really caught your attention?
Well, Cristina, let me tell you, Rose, Joanna, Amber, Sandra, Madeline, and Georgiana all did a very great job at giving me assistance. And I would love to have each and every one of them as a community health worker if I needed it, because they were very knowledgeable. They, were very firm. They kind of like was very smooth, and they was listening and compassionate with me. They heard me. They gave me options, offered assistance in different ways. They address different needs and ideas that I can utilize to help myself become a self-manager of my own chronic health condition. And I thought it was absolutely beautiful. Thank each of you beautiful ladies.
Yeah. Yeah, thank you. I really liked, some of you really, the affirmations, right? Some of you, it took a little while, right? But there was a few positive affirmations there, and just validating Rosina's being a busy mother and just validating that, right? And just hearing her out. So I thought that was really good. I also want to hear from the group. As far as the group, like, how did that feel for you guys? How was that in terms of just, yeah, if anybody wants to just unmute, raise their hand, maybe.
This is Amber. Can you hear me?
Yes.
I will say it was an exercise in active listening, because, putting aside, making sure, like, am I using any of the ors? Am I listening to the client and whatnot? You really had to listen to what the other folks in the room were asking as CHWs, so the conversation kind of continued to make sense. So definitely an exercise there, which I think is really important for community health workers. I think so often, just people in general, we get caught up in listening to respond, as opposed to listening to hear. And so just that was something that I took out of it.
Thank you. I see Madeline's hand is up.
Hi. I always love these classes. I was lucky enough to do the 6 weeks course with Tim and Miss Dory. And I always think to instead of to respond to like give resources to respond and to just listen. And I always think it's still hard for me to slow down and just not be like, oh, like when she brought up the food, I was like, I didn't want to immediately bring up, well, I have a resource for that. I kind of want to just again listen.
Yeah.
And so I always appreciate these
Yeah.
conversations.
Yeah. And I just want to recognize that, some of us may work in agencies where we're giving a time limit. There's a quota. You have to see this many clients or you know what I mean? So our time could be limited, right? And just like we get caught up in those numbers and because our supervisor is pressuring us. So we do, right? And so slowing down can be difficult. Right. But I always turn around and be like, hey, just give me a moment, give me an extra 5 minutes, an extra 10 minutes with this client. They're going to come back because we heard them, because they felt like welcomed here. Right. So that is difficult. And I want to, point that out that it can be a challenge but that is a way in which we're advocating for our clients, by telling the supervisor like, hey man, like I need some more time. Let's look at this. So I see Reeves, sorry, I don't want to butcher your first name, but Reeves, your hand is up. You were unmuted. You're muted.
Oh, so you can't hear me?
I can hear you now, yes.
Okay. So I'm Makaya. For me, the role play was more insightful because it was more of a conversation than a service. There was a whole lot more compassion than a what do you need in a checkbox. Like it's very open-ended to the point where they continue to care. It wasn't just a one and done type of interaction. It wasn't, I need food service. Well, I'm finna sign you up to the pantry. You have a great day. It wasn't that. There was more intentionality about the whole service. And you could tell like there was more comfortability as the conversation kept going. And that's really going to draw the community and that's underserved to come back for more because you care. So.
Right. Maybe you gain some empathy for Rosie.
Exactly.
And what's wrong with that?
Well, I don't think anything as far as being a CHW, I feel like you should have all of that working in this field, Yeah. So, just the intentionality behind those conversations is just beautiful. So, yeah.
Okay. We got one more comment and then I think I don't know how much time we have for Q&A, but I definitely want to make sure that we get to the Q&A if that's okay. I see Georgina and then Rose.
Yeah, I love the plus and the delta. I'm going to be using that from here on out. Also, and I find in this work that even if there is a social determinant of health or whether it is disease, whatever may be, hypertension, diabetes, I have found that just asking them how they're doing can open up a whole can of worms and you never have to ask another question. Especially when you depending on where you meet them, if you meet them at the bedside in the hospital or if you meet them at their home, it's just like, how are you doing today? And and read in the room, whether it be on telephonically or visually, like listen for those pauses. And when during the role play, Rosina was like, yeah, I'll be trying to get the kids in the car. That was frustration that she was letting out with that. Yeah, I'll be trying to get the kids in the car. So like that's a tense thing for her. So I find that, just asking them like how your day is doing can open up a whole can of worms of the resources that they need, where they're neglecting themselves, and how you can step in and support.
Yeah. Yeah. Thank you. Thank you, Joanna. Rose, do you have a question or comment about the role play or just about the presentation? I think we need to move on to, yeah.
It was just to say to educate to our, our members or our patients, that's it, or Rosina, just sometimes just educating them That way you can move on to your next patient or your next member, client, educate them, about the resources. So that way maybe they're doing better, but next time they come around and they're like, oh, I remember Rose sent me resources and I want to say she used this website, just educate them, because a lot of them have no idea that there's resources available. So that's all I wanted to say, education.
Great. Thank you. Thank you. All right, so I think now we can transition over to just any questions, comments about just everything that we went over in the last hour. Feel free to raise your hand or unmute yourself if you're able to.
And I will also share our contact information after this slide as well. Oops.
Maybe we should just put the screen down for now, and we'd love to hear any questions that you have, feedback. We'd love to hear about your experience training CHWs.
This is Amber. So I am a CHW in New Hampshire, and we actually use the Foundations textbook in our CHW training. We're one of 2 training facilities in New Hampshire, and I'm not sure if the other one uses the textbook or not. That's aside. But I just wanted to say, we've been using it since 2017, 18. And we are getting ready to teach our first training using the newest version of the book. So we have been going through the new book and just really excited to see a lot of the updates. We had naturally kind of started to add in some things based on the current climate. And what we've learned over the last handful of years. And we were just really excited to see a lot of that reflected in the new book. And it was really validating for us to make us feel like we were on the right track. But also just really exciting to see a lot of current information and faces that the people that we're training recognize in the CHW community. So just super excited about the book. And yeah, really glad I attended today. Thank you.
Thank you.
I see Madeline's hand up and then Sarita. Madeline, if you want to unmute yourself.
Can you guys hear me? Oh, yay. Okay. I had questions. I don't know how to ask this, but I know we had it in our trainings and I just kind of wanted to get a rethought on it because I met with a person who was part of the LGBTQ I don't know how to.
Community.
And I did ask for pronouns, but I had a hard time, I was stuttered like how I just did, because I didn't want to offend, but I don't want to say anything wrong to make offense, if that makes sense. So what is a real easy way to ask somebody, instead of just, I guess it's just coming off and saying, hey, what are your pronouns? I want to make sure that I address you correctly. But then I blanked. And so I would just like some advice on that.
I always think that just starting with our own pronouns is a sort of opens the door. So by saying, it's great to meet you. My name is Tim Berthold. I use he, him pronouns. What name would you like to call you by? And what pronouns do you use? The worst thing that's going to happen is somebody's going to say, what do you mean by pronouns? And you'll explain it. But for somebody for whom pronouns are really important and their pronouns may be different from what people assume, that's such an important thing to do. It's the difference between somebody feeling like maybe they'll be welcomed and safe and somebody feeling like I'm going to be discriminated against here. So I think always leading with our own helps to open the door. If that makes sense, Madeline?
Yeah, because that was kind of the situation is I called just for a wellness check, and then they expressed that they didn't feel comfortable with their doctor and to get them a new doctor because their doctor was not necessarily kind to them regarding their pronouns and their situation, and what they were trying to accomplish. So then that kind of opened my doors when I was like, oh, okay, what is your preferred name and what is your pronouns. But then I still feel like, because then I stuttered, I was like, oh, I'll find you a doctor. I can help you find a doctor that is, I was trying to think of the name, but then I was like, she's like LGBTQ, and I was like, yes. And I was like, dang it,
we
I
will make
paused.
mistakes. You will make mistakes. I will make mistakes. We all make mistakes as CHWs. The important thing is to be able to recover with a sincere apology. People are really usually very generous about accepting that, and they'll tell that you're trying to do the best to support them. There's a note here just saying that the next workshop is about to begin. So we will have to say goodbye. Thank you, everyone, so much for attending, for participating. Please contact us if you wish. We always love to talk to fellow CHWs and fellow CHW trainers and just share ideas and resources about how we can better do our work. Thank you also for all of the work that you do in your own communities.
Thank you. You guys have a great afternoon.
Yes.
Thank you.
I'm gonna stop sharing.